There we go.
My name is Patricia LaBrosse, and I'm the Louisiana Nurses Political Action Committee chairperson. LANPAC is conducting interviews with candidates for state legislative offices. We want to learn more about our candidates, where they stand on issues important to nurses and health and welfare of our Louisiana citizens. We solicited an input from nurses around the state for what those issues were that they are most passionate about, and we developed a questionnaire that we sent out to all candidates in the 2023 elections. So I am delighted to welcome Dr. Tammy Savoie, who is running for 23rd District Representatives for the House of Representatives for Louisiana. And what we'll be doing is I will be, well, actually, she'll be starting with, I'll be reading the questions and she'll be answering the interview questions that we had sent to them. So she will be responding, and then she'll have a few minutes at the end for some closing comments. So question one, Dr. Savoie, and thank you for your very comprehensive, thorough responses. Prior to COVID-19, we recognized healthcare services are not accessible on an equitable basis nationally and in Louisiana. Healthcare is only 20% of what accounts for one's health status, and the social determinants of health are non-medical factors that influence health outcomes. What strategies do you have to assist in reducing social determinants of health impact on the citizens of Louisiana?
Okay, so thank you, first of all, for inviting me here. I really appreciate it, and I have enjoyed working with nurses over my entire career. So I have a lot of respect for everyone that will be viewing this video. So there's a lot of things I think we can do legislatively. Now, as a psychologist, I understand that the social determinants of health are extremely important. And that's the kind of thing that I do on a daily basis with patients, or I have done throughout my career, is to try to help them with the social determinants of their mental well-being, which influences physical health as well. So in that regard, legislatively, what we can do, and I have my questionnaire in front of me. I'm not going to read it all because I did go into quite some detail. But first of all, poverty is the single most significant stressor that an individual can encounter, because it creates such stress on individuals and families when you can't pay for basic necessities such as housing, utilities, food, transportation, and healthcare. You tend to encounter more chaos in your life and more crime in your life. So we have to address poverty. And one of those things that we can do to address it is raise the minimum wage. I would also, like to enhance, and how do we, again, that's one way to decrease poverty, but also through the education system. Our charter system has been pretty much a failure here in New Orleans. And we have to go back to, I believe, a standardized structure of public schools that are not run by for-profit entities that just invites corruption and graft. We need to have a board that is only interested in the well-being of our children and the education of our children, and not in their own personal financial well-being. I would also, guns, it's basically, and there's another question on gun violence, so I won't get into that too much, but we have to do something to reduce the gun violence and trauma that causes across our communities, and particularly in New Orleans. Okay, and then we have the environmental crisis and environmental racism that we have to address. And this is a looming, it is upon us right now, and the effects of this, the serious effects that we are going to encounter are looming over us. And if we don't tackle that right now and say, put it on the table and say, what are we going to do? How do we move from what we're doing now to a very green infrastructure and such things of that nature? So I have a whole plan for that. But this is one thing that we will significantly improve the social determinants of our health. Now, if you look at our communities, we have food deserts, that, rural areas, even in the New Orleans, okay, where there is pockets of neighborhoods that don't have access to fresh fruits, vegetables within 15 minutes of their home. Okay, so we have to do that. And then, of course, having every child have a healthy breakfast and a healthy lunch, regardless of whether they can pay, is extremely important. This is how children learn. They can't learn, they can't be social if they're hungry. So this is extremely important. And then I have in the rural areas of our state, we have to have broadband internet and transportation, particularly to schools and healthcare facilities. And I would say even to grocery stores to get the good food that that people need. So there's such a comprehensive plan that we need to develop for tackling these social determinants of health. Now, one thing I did not put in my questionnaire, and something we can do that that really helped during the pandemic, was increasing the child tax credit. Now, that was enacted in 1997 with broad bipartisan support. And this really helps families with children under the age of 17, because before COVID, we had $2,000 for each child under the age of 17 to single parents earning up to $200K per year. This significantly helps reduce poverty, which reduces all the stressors that I talked about and improves the social determinants of health. During COVID, we increased this to $3,000 and made it fully refundable, so that even if you didn't owe income tax, you would still get it. And this drove the nation's child poverty rate to a record low of 5.2%. Now, the federal government just slashed that, okay, and they removed the increase, and they went back to what it was before, and the child poverty rate basically spiked. It went from 5.2% to 12.4%. So in terms of the social determinants of health, we just, destroyed that with this one move. And by slashing that, the US government saved about $109 billion. Well, good for us. However, we will not reap those $109 billion because it will cost us in the long run, because child poverty leads to a slew of effects down the road. So the child doesn't get a good education, they're hungry, they live in chaos a lot, they are housing insecure, they're food insecure, they tend to have poorer educational outcomes, poorer job employment outcomes. So it really was not a good move. And look what we did. We reduced the child poverty rate to a record low of 5.2%, the lowest on record. And we know how to do it, and we refuse to do it. And so right now, we have some representatives like Joe Manchin who said, well, we don't trust people to spend this money wisely. But that's just not the case. And we know that from the pandemic records that low-income families spent their extra money on food, housing, clothes, and school supplies for their children. And finally, in this today, having a job is not enough, because the cost of living is so high. We have record unemployment. We have a workforce boom, and we still have child poverty at 12.4%. So it's not like parents aren't working and working two jobs. It's just that the cost of living, housing in particular, has gone up so much that people are at their wits' end and spreading each dollar as thin as it will go. So these are a lot of things we can do. Poverty is the main issue that we can tackle with social determinants of healthcare, along with the environment. So I know that was a long-winded answer, and I apologize for that.
No need to apologize, because it's very comprehensive. It answers a lot of what we're asking. And so we appreciate your thoughtful consideration of the question and your thoughtful consideration of your response. And with a lot of data to back it up. So thank you. The next question is about the faculty shortage and nursing faculty shortage in education in Louisiana. How would you advocate for federal and state funding to support recruitment and retention of nursing faculty to reduce the shortage?
All right, and this shortage, along with the shortage of nurses across the country, is extremely important. And the only thing from a personal experience I know of as being an adjunct faculty member for several universities over the course of my career in the military, I taught while I was in the military, is the low pay is ridiculous. You know, it's I don't know, pennies on the hour in terms of how much you spend. So as far as the nurse faculty survey, the nurse faculty shortage, I looked at the nurse faculty survey, and I'm not an expert on nurse faculty. So I would depend on your organization, other nursing organizations and professional organizations to guide me and to educate me and to work with me to develop a legislation. But from the nurse faculty survey, and I'll read these right off the bat because I think they're very apropos. So remove legislative barriers that are preventing nurse faculty from working as adjunct faculty upon retirement. The only experience I have with this, I have two friends that one was a dean at University of New Orleans for the English department, and one was the assistant dean. And after you retire, you can become an adjunct faculty, but the pay is so bad, it just wasn't worth, the juice wasn't worth the squeeze. It was, so we have to allow this, but then to say, okay, if we want retired nurses to work as adjunct faculty, which would be great, because a lot of people, when they retire, myself included, I didn't want to get out of the game completely. I wanted to continue and maintain that connection. But I wanted to be paid what I was worth without, didn't need all the benefits or anything like that. And I didn't need the full salary, but I needed a decent salary. So that's really important, because retirees, I think, are a resource that we are not using to tackle many of the issues that we have in our communities. And the second one is community, business, and philanthropic leadership should sponsor new and existing nurse faculty in their community in ways that increase the retention of these new existing nurse faculty. And so I would really rely on y'all to help me with that. We have a new nursing school, which is very exciting, right here in Delgado, in the heart of the city, right next to City Park. It's beautiful. It's going to be great. I'm excited for it. They're going to be involved in the new bio district that we're developing. So I would really, really like to coordinate with y'all and say, what can we do? And then the third one is healthcare systems should partially or fully pay for salaries of nursing faculty in the form of a sponsored professorship or other mechanisms. Is a great idea. And state and community leaders, academic leaders, public policy leaders, we all must work together politically and financially to increase nurse faculty salaries to a level that would be competitive with that of salaries offered in the clinical setting. So teaching is important. And of course, if you're in the clinic, you get paid more. And I think we need to raise the salaries of teachers. And most of the time, that's not all teachers are doing, is teaching. But if you are teaching, and that is your profession, you are giving everything you have to that. And it's equally important to salaries in the clinical setting. We must do that. So I would work with the Louisiana Center for Nursing to put forth this legislation, to draft the legislation, and to help me establish relationships with other legislators to get the legislation out of committee and then onto the floor for a full vote, and then get it over to the Senate and do the same thing. So I'd work really hard to pass legislation to relieve these barriers to get this done.
Thank you. Next question. Gun violence continues to roar through our communities, schools, houses of worship, shopping malls, grocery stores, outdoor gatherings, et cetera, et cetera, et cetera. What factors do you see as critical to bringing an end to these senseless acts? Do you have a strategy to address the problem?
Well, what a problem. And it's really I just can't imagine. You know, we've been to war, the United States, but we have wars going on right here in our country. We have a killing field in America, and we really have to address it. It's unbelievable. It's an embarrassment to our nation. It is inhumane that we continue to let this happen without doing anything. So the status quo is untenable. So we need a comprehensive strategy. And, you know, one of the things that we have to do is our young people don't have the skills that it takes to resolve conflict. And not just our young people, you know, grown-ups, 20-year-olds, 30-year-olds, 40-year-olds who go out and do this stuff. So we really have to learn how to resolve conflict without violence. And we can start, this will take a while. We need to start in school with teaching kids how to resolve conflict. And that has to be a part of our curriculum. And of course, I've already talked about reducing poverty and stress associated with racism, lack of opportunity. And of course, we have to address the gun problem because, you know, we know that addressing the availability of guns will help reduce the gun violence. There's just no question about that. We have the data on that. And of course, you know, back in the day, we had legislation that wouldn't even let the CDC do research on that. You know, so we have to tackle the NRA and dismantle them, you know, in terms of their influence over the gun lobby. But anyway, universal background checks, no loopholes on that. Training courses for anyone who owns a gun. This is only common sense. Registration of certain types of weapons, the outlaw of bump stocks and ghost guns. Personally, I would like to outlaw AR-15 type assault weapons. These are weapons of war and of mass murder. If we can't do that, which is, you know, given our legislature, we probably won't, but that at the very least, raise the age requirement for ownership and require registration of these weapons. Implement red flag laws. Now, I'll talk a little bit about this. When I was in the military, of course, as a psychologist, I did evaluations for what we considered kind of red flag laws in the military. They were called command-directed mental health evaluations. And commanders who were concerned about their troops for any reason, but in particular, those troops that carried a gun, security forces or anybody else, on a regular basis, if they were concerned about them, if they were acting out, if they were in a relationship that wasn't working out, if they were using drugs or, well, if they were using alcohol, you know, people not supposed to use drugs in the military, but things like, they would send them to me to do an evaluation, say, Tammy, what do you got for me? Because I'm afraid to have this guy on the line with a gun. And I would do an evaluation. And whether this guy was just going through a hard time, a breakup, and these are young people going through a breakup and thinking about, you know, life's not worth it anymore, whatever, you know, my recommendation might be, okay, let's remove the gun, let's get this guy some treatment, and then we'll reevaluate and, you know, probably send him back to duty in, you know, a couple of weeks, whatever. If somebody was having hard trouble sleeping, you don't want somebody who is sleep deprived for 3 days carrying a gun, you know, or patrolling with a gun. So, you know, I did that on a regular basis. This was a normal part of our daily life in the military, was making sure that people with guns were safe to carry guns, not to mention all the training they got before they were able to carry a gun. And we all got training on that. And if you carried a gun on a daily basis, you got regular training on that. I think we need to hold parents accountable for any crime committed by a child with the parent's gun, and ban gun ownership for individuals who commit domestic violence. No ifs, ands, or buts, and no recourse. You know, you commit domestic violence, you should not own a gun. So these are some of the laws that can be implemented. I think we need an overall strategy to address violence in our society and the use of violence to resolve conflict, and particularly guns. So that's part of what I see as solutions.
Thank you. Next question. Fentanyl test strips can be used to determine if drugs have been mixed or cut with fentanyl. With important information about fentanyl, healthcare providers can take steps to reduce the community risk of overdose. how would you support legislation to make these rapid fentanyl test strips more readily available?
Yeah, I talked about this, Narcan became available nationwide just recently without prescription. So now I think you can get it at CVS and Walgreens, and this is a real good thing because people who are using drugs, or if you're the family, the partner, the sister, the brother, someone who may be addicted to opioids, you can go get it, have it on hand. Healthcare providers, anybody can now get it without a prescription, which is a really good thing to reduce harm. And there was, this outcry of, this strategy of harm reduction. Nobody wanted to do that for a long time. But, you can't save somebody if they're dead. So the idea that, okay, let us save somebody who has overdosed and get the Narcan in them, bring them back, and then we can try to treat again. And if this is your loved one, this is really important. So this was great. And I think we can use that as a template for the deploying the rapid strips, okay, the fentanyl strips, and to make it available for anybody and have it available at Walgreens, CVS, Walmart, so that the general public can get a hold of this. And if you are using, people die, and y'all know this, people die of overdoses when they don't even know they're gonna be consuming fentanyl or opioids. And it's a dose that they can't handle and they die. But if they were able to test their drugs, whatever they're using, to make sure they're not using opioids, this would go a long way to cutting the opioid overdose death rate. And I think it's one way that we can, again, cut or reduce the unintended overdoses, unintended fentanyl use, and anything we can do to reduce harm from this devastating epidemic that we have, I think we should try. And so that's one way I think we can do it.
Thank you. Next question is about access to care. Are you supportive of actions to remove arbitrary barriers that prevent all healthcare practitioners, including advanced practice registered nurses, from practicing to the full extent of their education, licensure, training? And yes, that's the question. I'm sorry.
Yeah, and my answer is yes, of course. I mean, and I've answered this question many times in forums and in front of nurses, and I think in different situations. This is imperative that we allow nurse practitioners to practice to the full extent commensurate with their education, licensure, and training. And we just do our citizenry and our patients a great disservice if we limit their scope of practice, in which they are trained to practice. So basically, this is a guild issue, and it's a power play on the part of the physician professionals, the medical associations. There's enough clinical work to go around, and there is enough money to go around to pay APRNs an appropriate salary for the work that they do and the training that they have. And we just have to set aside the guild issues and allow people, psychologists went through this as well. So I'm very versed in the guild struggle to say we are trained to do this, and we should be allowed to practice independently, and we don't need your oversight, okay? And if we need a consult, we will get a consult, because that's what we're trained to do. And I think that APRNs are trained to do that. And, we all know the limits of our scope of practice. And when something falls out of our scope of practice, we will get a consult. And so I just think this is imperative, because the more that healthcare practitioners can practice independently, go out and do what they need to do, the more access to care that we have for our community. So that's my feelings on that.
Thank you. What are your legislative priorities?
Okay, so I have I put them into three buckets as I've written, and local issues that really are in the face of us every day, and that's crime and public safety, to include the gun violence that we experience here in New Orleans. Affordable housing, we have a real housing crisis, affordable housing crisis in New Orleans, and that's due to insurance, utilities, a whole number of things. And I've talked about how we can mitigate that in many different forums, and I have a whole plan for that. And then storm and infrastructure mitigation as well. So those are the local issues, three local issues that everybody is concerned about and we have to tackle. It makes the quality of life here either bad or, livable. And then we have social justice issues, access to health care, particularly women's, access to health care in general, but women's reproductive health rights. We have a crisis in maternal health care right now and women's health care, particularly obstetrics and gynecology. And it is devastating for a lot of women now. Of course, we've always had high infant and maternal mortality rates, in addition to high preemie and low birth weight babies in Louisiana. This is a problem. It's been a problem for a long time. We have the solutions to this. And it kills me that we don't say this is a problem, this is how you handle it, and let's go out and solve it. And I've addressed the legislature to that. I've spoken to the legislature, and they looked at me like I was just out of my mind, that they thought this was not a problem. And if it's not a problem in their district, then it's not a problem for Louisiana. So that is that's a big issue for me. And I did a lot of infant work when I was in graduate school and the 1 or 2 years before I went in the military. And then educational access and opportunities, of course, universal pre-K for all 4-year-olds, criminal justice reform. And I have a whole list of those as well that I won't go into, but we have to do things like eliminate the death penalty, a number of other things. LGBTQ issues and the treatment of our LGBTQ community citizens in a very dignified way, to include getting the health care they need when they want it, and and how they see fit. And then the third one is more global and theoretical, but very real. It's threats to our democracy. And we have to address income inequality, a living wage, voter rights, those sorts of things. And of course, undergirding all issues is the environmental crisis that we face as a state and a country. And it's imperative, like I said, that we put this on the table, we come up with a plan, and we address it head on. And we're not doing that. And I have a list of things also that we can do, but I won't get into that here. It's very long and comprehensive, but I hope that we can tackle that. And I hope to tackle it with my co-workers and the communities that are working on this. So that's the legislative priorities: local issues, social justice issues, threats to our democracy, and the environmental crisis.
Thank you. Last question. Why should the Louisiana nursing community support you as the best candidate for this legislative seat?
Okay, I believe that I'm unequivocally the best candidate to advocate for the nursing profession in Baton Rouge. And, I was at one forum a couple of days ago. I was referred to as arrogant because I was talking about my credentials and, and also power hungry. And that kind of goes back to the old trope that if you're a woman and you have credentials and you spout them like the other men in the forum were doing, that, somehow you're not confident, but you're arrogant. And if you want to pursue a leadership position, you're not looking out for the community, you're power hungry. I mean, the man who said this was also looking out, was pursuing this position as well. So at risk of sounding arrogant or power hungry, I really believe that I can advocate for the nursing profession and your patients more than anybody else that is running in this race. As a clinical psychologist, having served in the Air Force on active duty for 22 years, primarily in the Air Force Medical Services, I am intimately familiar with the structure of the healthcare system in our country. In the hospitals that I've worked at, I've served on the executive committees. I have reviewed Sentinel events. I've served on credentialing committees and quality review committees. I know what these are, okay? So I understand the challenges facing the medical care system in our country and in Louisiana in particular. So the medical industrial complex in the United States is complicated and expensive. And, you know, if you have money, you are going to get really good care. If you don't have money, and if you don't live in the right area, and now if you don't live in a blue state, you may not get good care at all. And we must do better to ensure that our healthcare system is driven not by profits, but by beneficence and non-malfeasance. So throughout my Air Force career, I have been supervised and mentored by nurses, and I've worked beside nurses, and I have supervised and mentored young nurses. And y'all have my deepest admiration and respect. And I understand the crucial role that nurses play in our healthcare system. And without a strong nurse corps, our healthcare industry will unravel. So I can't get to Baton Rouge on my own. I need your help and support. And I need your grassroots support, your professional organized support, and I need your votes. So please support and endorse my candidacy so that I can go to Baton Rouge and support you in your noble profession. Thank you so much.
Well, thank you. I was going to give you some time, but I think that was a wrap up. I do need a clarification. I have that you're representing you're looking for the seat for the 23rd district, New Orleans, correct? Okay. In one of the replies, it's said to advocate for the nursing professions in Baton Rouge. So what I'm thinking you meant was to be in Baton Rouge in the legislature to advocate for.
Yeah, to go to Baton Rouge.
Wait, did I get confused? I just wanted to be sure. I thought.
I think I've confused people before saying I want to go to Baton Rouge and do this, and what I
want to be in Baton Rouge.
I want to be in the legislature in Baton Rouge.
Okay.
Thank you for pointing that out, and I will have to adjust when I talk about that because you're not the only one that I have confused with that statement.
Okay. And a question that I have is when you mentioned you have plans for different segments of the responses that you've shared with us today, do you have a website with your plan up on the website, or is this something that people would contact you for, or do you have a playbook, blueprint, whatever it is you want to call it, that's available?
I have a website, tammysavoie.com, and you know, I don't think it's as detailed as what I have on paper, like a blue book and some of the responses, some of the plans that I've laid out. But the website is more detailed than some of the things that I've went into, and I can update that in the coming weeks as well to make sure that everybody knows what I'm talking about. So, yeah.
Okay. And in the spirit of clarity, I need to, I see that Lisa Deaton's name is on the screen. Is that correct? Do you see Lisa Deaton as your speaker? Under my picture, do you see Lisa Deaton?
Yes, I do.
Okay, well, I'm not Lisa Deaton. Lisa Deaton is the person, I guess, who used this before, and I need to go in and get that name out and put my name on. But so for the purposes of clarity, for those of you who are viewing this, let me again reintroduce myself. I'm Patricia LaBrosse, and I am chair of the Louisiana Nurses Political Action Committee. And I want to thank Dr. Tammy Savoie for taking time out of her very busy schedule to share your responses with us. And thank you again for the comprehensive information, data-driven, that you've shared with us. So good luck with your campaign and have a wonderful rest of your day, Dr. Tammy. Thank you.
Y'all too.
Bye-bye.
Bye-bye.